pregnant women would face this problem of morning sickness. Sometimes the specific sensitivity towards certain odors is also present. Sometimes they have continuously nausea feeling, or sometimes they have full-fledged vomiting too. There is a general tendency to have altered appetite, specifically disliking some foods or liking only certain foods. To overcome the morning sickness, it is better to observe what is the trend, when is the nausea feeling very strong, either in the mornings or towards the evening. It is better to look at these trends and accordingly prepare so that the mother's nutritional status is not affected. We call many women have a general morning sickness and hyperemesis which subsides in a few weeks, but if it continues or the number of vomitings are very high and continuous, and if there is weight loss in the mother, that is the time she needs medical intervention. What kind of diet will help? It is better the mother prefers bland, mild foods which do not have strong odors, which are not made with heavy oil or greasy foods. It is better to have short, dry meals. It is better not to consume liquids along with the meals. It is better to take liquids separately, and that too with a small glass in sips, not with a bottle, or never drink swiftly. It is better to have liquids at cold temperature and try to sip them. Totally avoid aerated drinks, and the preferred choice would be dry short meals, like compared to a cup of sambar rice, it is the pregnant woman would naturally tolerate a handful of cereal with cold milk, or the pregnant woman would be able to easily tolerate a sandwich compared to heavy upma. And it is better to combine cold drinks, like anything which is taken at the cold temperature would actually reduce the nausea. Suppose for example, maybe a cup of cold curds is better tolerated than a cup of curd rice. Strong aromas and heavy oily foods need to be avoided. Many a time people would try to tempt this woman with spicy foods and strong flavors, but maybe they would end up eating, but later on they would have difficulty in digestion. So it is better to have easy to digest short dry meals, and they can actually take more calories from juices. Even Tetra Pak juices also are fine to some extent during this period. Dry fruits like dates and anjeer, handful of nuts would also be tolerated easily. Biscuits, dry toast, sandwiches are also good option.